Hello everyone, I am Dr. Anand Lakshman. I am the CEO of Address Health. Address Health has conducted a school health check in your child's school. I want to take a few minutes to explain to you why we do a school health check and what the findings are supposed to reflect. You see, children are growing, and as they are growing, there are different needs that they have, as well as different health conditions that they potentially may suffer from. Many of these conditions do not get picked up because we do not have enough wellness visits that we are paying to the child's doctor. Usually we are going to the doctor for either when the child is very sick or for vaccination. So it is important to screen children as per their age requirements to figure out if there are any problems that we may find. Now, while we conduct what is called health screening, it is basically we are trying to look for potentially harmful medical conditions in children or things that prevent their achieving their full growth potential. And while screening, we tend to over-screen. We tend to ensure that we screen more children who may be at a slight risk of a condition rather than underdiagnosed. The reason for this is we need confirmatory testing. We need your children to go to the doctor with the conditions that we have diagnosed and discuss if this were a genuine problem. For instance, if you take the example of thyroid enlargement in children. Now, typically the community data suggests that about 4 to 5% of children may have thyroid issues, but they are not often picked up because there will not be enough signs and symptoms to report till they are a little older. Now, we will look in the school for clinically any enlarged thyroid, and we will send such a child for follow-up with your own doctor or pediatrician. This will ensure that some of the children are not missed. So, it is not for you to feel scared when you see a report from our end. In our report, we look for more than 200 odd conditions that the child may have, starting from head to toe examination, anthropometric assessment that is indicative of nutritional status of your child, dental examination, vision examination, hearing screening, and a systemic examination. And after doing all these checks, we suggest a few referrals and recommendations. We would suggest that you need to probably meet your child's pediatrician or your child's dentist, or you need to visit an ophthalmologist or get a detailed eye checkup done. These kind of recommendations will be along with some action, for example, dental restoration or correction of dental malocclusion or maybe evaluation for spectacles. So these kind of recommendations and referrals are made with detailed report provided so that your child's doctor or your child's dentist can then evaluate whether these are required or not. This is done worldwide, including in India, where the government of India runs a national program called Rashtriya Bal Suraksha Karyakram. We at Address Health are taking this forward in schools, reputed schools of Bangalore. We hope that your child benefits from such a program.